Defense vehicle was hit by an improvised explosive device, commonly referred to as an IED. The resulting blast killed the gunner, Specialist Donald McCune, and severely injured both my Lieutenant James Osmer and his driver, John West. When I returned home, I noticed I had increased anxiety when driving, especially in traffic. I had intrusive recollections of some of the things that had happened over there, and I had trouble sleeping at night. But despite all of these symptoms, when it came time to fill out my discharge paperwork, I declined a request for a psychiatric evaluation for post-traumatic stress disorder, PTSD. I did this because at the time, I honestly thought PTSD was nothing more than a doctor's note for cowardice. When I enrolled in the honors program, they gave me the opportunity to study one topic in great detail, and so I chose to go back and look at PTSD and see if my initial thought that it was a doctor's note for cowardice was correct. One of the first articles I came across was a social history of PTSD written by Sheena Chamberlain, in which she put this quote: "By medicalizing this unmanly behavior, PTSD, doctors avoided being forced to diagnose personal failure, while military authorities avoided explaining the emasculating behavior of cowardice or of previously brave soldiers." No. Yeah. Which is, yeah, and it's not working. Yep. Sweet. I apologize. This seemed to confirm my worst fear, but I realized through more research that this is a limited and kind of selective understanding of what post-traumatic stress disorder. However, it was just one of many connections between PTSD and fear. What Sheena Chamberlain seemed to describe was the first main connection between PTSD and fear and cowardice, which is social stigma. Everybody I talk to thinks that PTSD is a military problem, that it affects the military more than anybody else. And in some regards, this is kind of true. Of the 1.6 million people who have served in the wars of Afghanistan and Iraq, approximately 300,000 of them have developed PTSD, which is a prevalency rate of 23%, which is more than twice the national average. But the national average is actually, the national average is 6.8%. But keep in mind, there are 250 million people in this country, which means there are over 21 million people with PTSD. And of that 21 million, 300,000 represents less than 2% of total PTSD cases. So clearly, PTSD and the military are not as indelibly linked as people think. The second connection I found between fear and PTSD occurs at diagnosis. PTSD is defined by the Diagnostic and Statistical Manual of Mental Disorders as an anxiety disorder, in which a patient must first experience a significant traumatic event, which is defined as experiencing firsthand or witnessing death or threatened death, physical harm or threatened physical harm, or being confronted with the knowledge this has occurred to a close loved one. Secondly, this event must have prompted an intense emotional reaction of fear, horror, or helplessness. Now again, this sounds like cowardice to me, but digging a little deeper, I found that the motivation for the A2 requirement was much more political in nature than medical. You see, PTSD was first officially recognized in 1980 in the third edition of the DSM, at which point it was believed that traumatic events were increasingly rare and generally outside the normal interactions of everyday life. However, once it was official and research began in earnest of this disability, it became clear that people were developing PTSD for much more minor traumatic events than initially anticipated. So to accommodate these people, when they updated to the fourth edition, they expanded what qualified as a traumatic event. But some people were afraid this would lead to frivolous claims of PTSD and lessen the severity of a real disabling. They were afraid that frivolous claims would diminish what is a real and serious mental condition. So they included this A2 criterion to kind of weed out these lesser claims, thinking that only people who experience this really strong emotional reaction would really qualify for PTSD. And while it may have done what it was designed to do, it's also known that it prevented people who had legitimate claims to PTSD from receiving a diagnosis and treatment. One study found that of female survivors of rape and sexual assault, 23% of them were denied a diagnosis of PTSD simply because they did not experience a sense of fear, horror, or helplessness. What we've come to understand is that those three emotions are just three emotions, but there can be a number of appropriate, deep emotional responses to a traumatic event, such as anger or rage or guilt or shame, none of which are covered by this definition. So I'm happy to tell you that as of last month, when they update the DSM to DSM-5, that stipulation has been removed. The third significant connection I found between PTSD and fear lay at the therapy options being offered. Currently, the most empirically supported therapy option for PTSD is prolonged exposure,